17 minutes after 7 o'clock this morning, and now to ending overdose. Today is Overdose Awareness Day, and we are teaming up with local organizations hoping to save lives.
So the main culprit behind this surge in these overdose cases is fentanyl. And throughout the day, you are going to see real stories, hear heartbroken families, see these real numbers, and also get some real answers. We begin with News4Jax reporter Ashley Harding, who's joining us now. And Ashley, you spoke with a woman who understands the toll that addiction can have on families. It can just rip them apart.
It certainly can, and she really understands that. The woman I spoke with works in medicine herself, and she says her stepdaughter had a long history of substance abuse, but her addiction to pills is what ended her life and tore her family apart. She hopes sharing her story will make a difference. As director of pharmacy at Orange Park Hospital, Dr. Jody Graves works to save lives every day. But one life that couldn't be saved was that of her stepdaughter, Angela.
It didn't come unexpected. It was a death pill. 1 in 10 pills out there are what they call a death pill.
This picture showing Dr. Graves on the right, Angela in the middle, and a second stepdaughter on the left are of happier times. But behind the scenes, a years-long battle with addiction was spiraling out of control. As Dr. Graves explains, it all came to a head when she herself was in the hospital after an accident.
I can't get up out of the bed, and I receive a phone call from this one individual, this one daughter. I got a headache. Would you bring me some of your pain pills? And that was the point that I truly knew it was beyond really redemption.
The numbers show Dr. Graves' family is not alone. According to the CDC, 538 drug overdose deaths were counted in Duval County in 2021, compared to 521 counted in 2020. Last month alone, JFRD received 391 overdose dispatches.
It continues to get worse.
I sat down with Jacksonville City Councilman Ron Salem and Chief Keith Powers. Both men sit on a task force which aims to fight this issue. In fact, Chief Powers says the area of town where they're seeing the most calls is Riverside, followed by Springfield, the 103rd Street corridor around I-295, and the Regency area.
We have multiple cases where we've gone 3 times in one 24-hour period to the same person that had overdosed. And one of the most heartbreaking things we see out there as first responders is when you have to turn around and tell a mother, a father, a grandmother, a grandfather that their loved one just passed away.
That's why Councilman Salem shows us nasal Narcan, which can be bought at pharmacies. With 4 to 6 minutes to act, this can save a life. If someone's not overdosing, this will not harm them.
Will not harm them. If there's any doubt whether someone has overdosed or not, use this product because you will not harm the patient.
Above all, the men stress this kind of addiction does not discriminate.
I'm a big proponent of do not buy anything on the street. You never know what you're getting. Can be laced with fentanyl, and all it takes is one time.
As her family still grieves, Dr. Graves also thinks back on good memories.
She would light up her father's life as a child. And I think more than anything, because I love my husband, his grief causes me to grieve. And he often asks, could I have done anything different? And I'm telling him, no. You did more, and matter of fact, some of the decisions you made, you shouldn't have made.
And Dr. Gray's message to other families going through this with a loved one, don't be afraid to set boundaries, even if it feels wrong in that exact moment. More than anything, she says it is important to remember it's not your fault, and don't be afraid to seek help.